Morning, Julia.
Winnie, thank you very much indeed for joining us. Well, despite all this recent surge in cases, although some suggestion actually the epicenter of the Omicron outbreak, which is London in the UK, does appear to be levelling off, and we may have been past that peak now. Boris Johnson yesterday said he wanted to stick with Plan B and was planning no new restrictions, and it looks like, and certainly until the end of the month, we wouldn't be getting any new restrictions. Well, certainly on the current data. Do you think he's right?
Probably, and it's probably too late to do anything about it. The virus is such a grip that any measures brought in now would be, shutting the stable door after the horse is long gone.
That's kind of often what we do, though, isn't it?
Well, I'm afraid so, yes, because clearly this Omicron variant is just like all the other variants. It took us by surprise. It had got a grip before we really knew it was around. I mean, the South Africans are very good at spotting it very early, and of course they had a big increase in the number of cases. But by the time that had happened, it had already come here, and it had got well seeded. I'm speaking to you from the north of Scotland on a snowy morning, which is part of the problem because winter is here, even though it's been so mild. That helps all these viruses. But we had it just about the same time as in London, except London, of course, there's a lot more international travel, a lot more people bringing viruses in. So by the time we knew about it, well seeded, gets around more easily than all the other variants, which got around pretty easily to start with. And so we're really back to just getting to grips with the virus that gets around very easily. Fortunately for Omicron, the data on basically it infecting the high-risk people, and of course there are a lot of high-risk people, Anybody over 60 is much higher risk than anybody younger than that.
And we are seeing those cases. I mean, Omicron first of all was going around in the 20s, and we know it's going around school children, and again, exceptionally low risk of Omicron, of COVID at all, let alone of this much milder variant Omicron. And frankly, we did know very early on in December actually that this was a milder variant. The evidence was very clear from South Africa, which for some reason a lot of our scientists decided they'll go ahead, they'll believe a model that's based on absolute nonsense, but you've got actual real world evidence suggesting something is very mild. For some reason they find it difficult to believe that. But there's no doubt at all that the cases are creeping up. Well, infections are creeping up in the over 60s because we can see that data. It's analysed by age and it's all publicly available. And that will be the concern, even though, of course, we know that far fewer people are needing to go into hospitals, percentage of infections, far fewer people needing any extra ventilation or going into ICU. Those numbers have stayed very static, even though we've seen this massive rise in cases. So there's a lot to be, not as concerned as we would certainly have been this time last year about this.
No, absolutely. I mean, Omicron may be less nasty for two reasons. One is the virus itself may be less nasty. And, the evidence on that is quite hard to get. And really, the only really good evidence is what does it do when it infects somebody in a high risk group. And the other thing, of course, is that nearly a vast majority of the high risk groups have all had not just their two jabs, but their boosters. And so they've got immune protection, even although Omicron can slip under the vaccine protection more easily than Delta. It still can't do it for most people. So that's another reason why we're not seeing the pressure on intensive care units, which for me has always been the absolute critical number. Not even hospitalization, but the people who have to go into intensive care, which is a big bottleneck because it's so labor intensive.
Yeah.
Because
and you can't just sort of draft in people to work in ICU, not even, let alone off the streets, but you can't even bring in often staff just within the hospital because it's such high specialist and highly skilled work as well. Well, you talked about escape from the vaccines. I mean, I'm double jabbed, not boosted, but I'd had my antibody levels tested a few weeks ago and was sky high. But I was away on holiday in Antigua, and basically, as far as I can tell, virtually everybody I know out there appears to have had it in the last week at this rate. It is spreading very, very quickly, and we were outdoors pretty much the entire time. So clearly, it's spreading outdoors as well. But this issue about boosters and more boosters, there's no doubt at all that the booster has been absolutely crucial in this country in terms of helping to save lives and save people from getting seriously ill, particularly those in the most vulnerable categories. But the JCVI chair, Professor Sir Andrew Pollard, so he chairs the Joint Committee on Vaccination and Immunisation, who've decided, the rollout, who got it first by age and by vulnerability, and and whether or not it was 12 to 15-year-olds got it or not. He has done an interview with the Telegraph today, and he says that the prospect of a second booster, the fourth jab that many people would be offered, he says shouldn't even be offered until more evidence that they're actually effective. He says we can't jab the whole planet every 6 months. It's not sustainable. We need to target the vulnerable, not worry about trying to boost all over 12s. Do you agree with him?
He has a very good point, and he's probably right. I can't say with certainty he is, but then we'd be going back to what we used to do with flu, where basically we focused on the elderly, and then we moved to children because we knew that children play a very important role in transmission. But of course, it's a different vaccine in children. It's a drop up the nose rather than a jab in the arm, and that's the sort of situation that we may well end up with COVID. That we'll have an annual shot, and the fourth booster type thing. Well, yeah, there is argument about that. The Israelis are doing it, but let's see what happens there. Let's see what happens here. And keep an open mind.
Yeah, well, the trouble is with this, there are a number of different reasons why I got my 2 jabs, and partly was just that, well, I'd had COVID a year earlier, and had my immunity faded? Did I need it? I worried about, there was a lot of expectation, a lot of belief, and certainly with previous variants that actually, if you were double jabbed, you were less likely to get it again or get it at all, and therefore less likely also to pass it on to other people. And I don't want to be a risk to my family members in their 70s, or indeed anyone else's family members in their 70s, and that made sense to me. But also, I'm going to be honest, because I wanted to travel. Travel is a really important part of my life, and I know that there are lots of countries I couldn't get into if I didn't get double jabbed. But now we're looking at needing to have a booster to be able to travel to many countries. Now it's going to be 4 jabs. If we're going to be a situation, I think France is going to require everyone to have had a jab within the last 6 months. We are going to be looking at a massive demand for these jabs, and basically a massive restriction on people's freedoms unless they agree to these regular jabs. And I know so many people who, they trust the science. They're very, very happy to have had. They were delighted. They were thrilled to get their first 2 jabs. Many of them are also very happy to get their booster, but feel that now they want to draw the line here. And even if they do go on to choose to get these jabs, that they don't feel it should be it's not compulsory on a technicality, but it kind of is if it limits your life so massively that you can't travel, you can't go abroad, you can't do a lot of things. If the vaccine passports we've got currently in use in England and certainly in other parts of the UK, limiting what people can do. Do you think that even if we do end up having these boosters and carrying on, or it's an annual jab, that these should be absolutely 100% voluntary and not have any sort of, any consequences for people other than their own health for not getting them?
Well, that's one of the big debates, isn't it? Interference with your civil liberties for health reasons. It's quite rare in other situations. Quite rare. I mean, there are situations where having a yellow fever vaccine going to certain countries for travel and so on is accepted, and so on. So, but I suspect that when all the dust has settled, if the COVID pandemic is winding down, it will cease to be a big issue because the virus is everywhere anyway, and the travel restrictions are often put in by governments not on the best best scientific advice. So I suspect in the fullness of time, but when that will be, I'm not prepared to say because
I don't think anyone is. No one's making predictions anymore.
About COVID is a fool's game, I'm afraid.
Well, talking of which, just finally, I want to ask you, given that right now, it looks like London was the epicenter for the Omicron outbreak. We're looking at 1 million people currently self-isolating. It looks like in London that we have possibly seen the peak in terms of infections in London. Of course, infections still going up in other parts of the country. But Professor Neil Ferguson of Imperial College, their predictions back early mid-December were that at the peak in January, we would be seeing, in their best case scenario, not their worst case, their best case scenario, 3,000 deaths from Omicron a day. Right now, it's about 100 a day. What do you make of that prediction and the need for us to go back and look at the forecasts? I think they call them forecasts or scenarios that are often used to guide decision making and policy making by government, and assess whether or not these are worth the paper they're printed on.
Well, yes. I mean, that's very uncertain measure, really. The number of people in ICU is far more important than the number of deaths, because not all the people who are registered as having died of COVID have died of COVID, and there will be other people who've died of COVID who are not in the figures at all. It's a very uncertain thing for all sorts of reasons. I hesitate to mention postmortems at this time of the day, but that sort of hard evidence about what somebody's died from is really very hard to get. I put always, one has to pay very serious attention to it, but it's not as important and not as good information as the number of people in ICUs, and so one can't ignore it, but it is important. But on the other hand, predicting the number of deaths is, again, not a very well. It might get us all scared, and of course, people have died of Omicron. It's not zero risk sort of thing to have, even if you get better and you don't get long COVID. But on the other hand, most people do get better. Most people, many people, don't have any symptoms at all.
Yeah, indeed. Most people, I mean, I have to say, I think I've been poorlier than most people I know with Omicron, I have to say. But there we are. Thank you very much indeed, Professor Hugh Pennington, Emeritus Professor of Bacteriology at Aberdeen University.